Brett Favre, Rush Limbaugh, and Elvis Presley and Michael Jackson. What do they all have in common? They were all addicted to prescription drugs at one time. You don't have to answer this question, but how many of you knew someone from high school who abused painkillers or prescription drugs? I did, and I'm sure every one of you knows at least one person who did this. Prescription drug abuse, especially the abuse of painkillers, is an issue that is all too prevalent today as our nation becomes more and more dependent on this medication. Through my studies of data and statistics by various branches of the U.S. Department of Health and Human Services, I have come to more deeply understand this epidemic that is sweeping through our nation. Not only have I analyzed numerical data, I have also investigated many stories about the pros and cons of prescription drugs and about cases where these drugs were abused. I firmly believe that Americans are becoming overly reliant on pharmaceutical drugs to the point of abusing them. I'm going to share with you a variety of statistics, what they mean, and reasons why prescription drugs should be avoided. As for basic facts, painkillers are highly addictive, and physical tolerance and dependency can develop even when following a doctor's special instructions. Some individuals can develop a dependency in just 2 or 3 weeks of use. Opioid painkillers are most effective in short-term use situations, such as breaking a bone or surgery or other injuries like that. Researchers suggest their effectiveness treating chronic pain is less than other medications. Painkillers are the kind of prescription drugs that are most commonly abused. The most popular drugs are codeine, Vicodin, oxycodone, and Demerol. Other medications include Valium, Xanax, Dexedrine, Ritalin, and Adderall, just to name a few. As for statistics, according to the Drug Enforcement Administration, 7 million Americans abused prescription drugs in 2006. In 2008, this number grew to 15.2 million. This is nearly a 50% increase in a 2-year period. The trend of taking painkillers for non-medical purposes is increasing mostly in the ages of about 18 to 26. And the 26 and older groups, which is where we fit. Among children aged 12 through 17, almost 12% of the population surveyed said they had used prescription drugs for non-medical purposes. Talking more specifically about painkillers, opioid painkillers like Vicodin, oxycodone, and Demerol cause more drug overdoses than heroin and cocaine combined. The abuse of painkillers represents 3/4 of all prescription drug abuse. About 1/4 of all drug-related hospital visits were caused by overdoses on prescription drugs. Even more shockingly, 40% of people believe that prescription medications are safer to use than illegal drugs. 31% agreed that it was acceptable to use medical drugs for non-medical purposes occasionally. These numbers prove that the abuse of prescription drugs is a rapidly growing trend in our country and as the younger generation's drug of choice. This epidemic must be stopped for many reasons. Reasons to avoid taking prescription medications. Many people disagree with my choice to not partake on this pharmaceutical drugs, but I have a variety of reasons why I chose this path. First of all, these drugs have a wide area of undesirable side effects. The side effects of oxycodone, verified by the FDA include nausea, vomiting, constipation, loss of appetite, dizziness, headache, tired feelings, dry mouth, sweating, itching, shallow breathing, slow heartbeats, seizures, cold, clammy skin, confusion, severe weakness or dizziness, or feeling lightheaded and fainting. The side effects of Vicodin, verified by the FDA, include feeling anxious or dizzy or drowsy, mild nausea, vomiting, upset stomach, constipation, headache, mood changes, blurred vision, ringing in the ears or a dry mouth, shallow breathing, slow heartbeats, feeling lightheaded, fainting, confusion, fear, unusual thoughts or behaviors, seizures, problems with urinating or nausea, stomach pain, loss of appetite, itching, and clay-cooled stools. clay colored stools. Sorry, not fun at all. And finally, the side effects of Valium, verified by the FDA, include drowsiness, tired feelings, dizziness, spinning sensations, blurred visions, sleep problems, lack of balance or coordination, confusion, unusual thoughts or behavior, unusual risk-taking behavior, depressed mood, thoughts of suicide or hurting yourself, anxiety, muscle twitching, tremors, and many more side effects that are not pleasant. It doesn't take a medical expert to see that these side effects greatly outweigh the benefits of this drug. And to me, all these crazy side effects sound just like being under the influence, or alcohol or illegal drugs like marijuana or cocaine. Most of these drugs are very easy to get addicted to, according to Dr. Aaron Filler, a Harvard graduate. You'd be surprised at what kind of medications are considered narcotic. The list includes codeine, aspirin, Tylenol, ibuprofen, Vicodin, Percocet, oxycodone, and several more that I've heard of. These all have a moderate to high risk for addiction, as they're all based on opium. Prescription drugs have more man-made chemicals in them that can be listed or discussed. Basically, you're comparing your health and safety to science, which is definitely not perfect or stable. I'm not comfortable with doing this, and I don't know about all of you, but after reading all these statistics, I'm even more skeptical than I was before. The mortality rates for prescription drug overdoses and reactions are disturbingly high. About 200,000 Americans die a year from overdoses, which amounts to 20% of Detroit's population dying over the course of a year. About 8,928 Medicare patients die a year from adverse drug reactions, which are accidental deaths from prescription drugs. If that doesn't convince you that prescription drugs are dangerous, then I don't know what will, honestly. After examining and compiling statistics and data, then analyzing it, I've become even more sure that the use of prescription drugs is an epidemic that America must be cured of. You can avoid addiction, side effects, and in serious situations, death by steering clear of these harmful substances. I hope that you are more enlightened about prescription drug abuse and the reasons why you should avoid using these medications. And I hope that you will use caution if you must use them in the future. Thank you for listening.